The world is in the midst of a monumental fight against COVID-19. As the World Health Organization and partners work together on the response, countries are racing to develop and deploy safe and effective vaccines. What's the latest reaction from the agency on the emergence of new variants of the virus? And as a member of the WHO, what's China's role in helping ensure equitable distribution of the vaccines? I had the pleasure of speaking with Dr. Margaret Harris, spokesperson for the WHO. Dr. Harris, thank you so much for joining us. Now, we understand that on the last day of 2020, the Chinese government officially approved the use of a coronavirus vaccine by Sinopharm. China has also announced that it will inoculate every Chinese for free, and the protection rate for this vaccine is said to be at 79.34%. So what is the comment from the World Health Organization on this development and the significance of it?
So, hello and welcome, and thank you very much for having me, and I'm wishing you all a much better 2021.
Absolutely.
With the vaccines, this is the good news for 2021, that we are now seeing a number of the candidate vaccines that have gone through the final phase of trials coming out and being rolled out in different populations. So this is very good news, but the important thing that everybody around the world needs to understand is it will take time for the vaccines to build up the protective barrier in people's bodies. So what we must do as societies is continue to take all the precautions to prevent transmission of the virus so that we can bring the level of the virus down while we're building up the protection in our bodies.
Could you brief us on the very latest on the COVAX program under the WHO? I understand that's a project set up under the World Health Organization to provide or to guarantee accessibility of vaccine, especially for countries that are less developed. How many vaccines have been secured, and what's the progress in terms of distributing them or getting ready to distribute them to those countries in dire need?
So there's some very good news on COVAX, and you're quite right. This was set up to ensure, and it's never happened before, it's an unprecedented approach, but early on in the outbreak, we realized that it would be very important to ensure that every country in the world would have access to vaccines once we got the vaccines had passed through the scientific stages. And COVAX facility was set up so that every country will have access, rich and poor. And we had agreements for close to 2 billion doses for the world. We do urgently need more funds. We need 4.8 billion to ensure that we can pay for all the vaccines. But we now are confident that we will be able to provide vaccines for the countries that normally in an outbreak like this would not have access. And we will be able to start rolling those vaccines out in early next year.
So you mean early 2021?
Early this year, my apologies.
Yeah.
We've changed.
Yeah. Well, you know, without knowing, we are moving ahead. But do we have some kind of a date as to exactly when the vaccines will be rolled out to countries, and which will be the countries that are going to receive them first?
So we expect that it will happen in the early months of this 2021. We're looking at, say, March, April, but we haven't got a specific date. And all countries, we're looking at rolling it out in all countries, because it's very clear to us that until everybody is protected, no one is safe. So we as the world must ensure that vaccination takes place in every part of the world. And of course, we as the World Health Organization will not rest until we achieve that goal.
Right. You talk about 2 billion doses. We know we have 7 billion people. How significant will the coverage be? You know, if you have 2 billion doses, how much protection will that give to people around the world so that we can at least slow down the spread of the virus?
It's a good point, and that's just the beginning. Of course, it's important to ensure that we can ultimately vaccinate everybody, but the most important thing right now is vaccinating the high-risk groups. And we've identified two major high-risk groups. One is the healthcare and frontline workers the people who are facing the virus every day. So these are the people who are actually battling the virus to save our lives. So they are a very high-risk group that need to be protected. The other group are people who are vulnerable to the most severe forms of this disease, this virus. So a lot of people don't have severe illness, but older people and people with underlying conditions do have the more severe illness, and they are the ones who are now filling the hospitals, and they're the ones who are sadly dying. We've lost close to 1.8 million people. So we need to vaccinate those groups urgently to take the pressure off the health system and, of course, save those lives.
What is the biggest challenge, however, for this project when you are trying to get funding, when you're trying to secure as many vaccines as possible? What is the biggest challenge you are encountering at this moment?
Well, certainly one of the big challenges is funding. But I have to say, there's been an extraordinary level of solidarity. Initially, there were concerns that countries wouldn't join, but most countries around the world have joined. So we've covered more than 90% of the world population among all the countries that have joined. And indeed, there were concerns that would we be able to get access to the doses? And of course, as the scientists were looking at the vaccines, we weren't even sure that we would necessarily have vaccine candidates by the end of the year. But so far, those challenges are one by one being overcome. The next challenge, of course, will be rolling out the vaccines. The logistics of getting everyone vaccinated in every country are enormous. So some people have called it scaling Everest. To me, it's more like a moonshot. But having seen what the world can do when we get together to use the science to deliver solutions, the solidarity I've seen in 2020 tells us that we can achieve these things. We can go on to ever greater things in 2021.
In a way, we must work together to achieve this. Tell us a little bit about the individual contributions from countries, especially from big countries, especially China. As I come from China, I would like to know what has China done so far to contribute to this program, and what else do you think China can do more?
Well, a lot of countries, including China, have made agreements, and I don't have the specific numbers, unfortunately, but have made agreements to contribute doses of the various vaccines that they are producing, and have also contributed financially. And the fact that the different countries join has also been critical, because as the momentum grew, we got an ever greater sense that this could really happen. This started as an idea early on in the outbreak because we wanted to ensure that there wasn't a scramble for the resources that only the rich countries would benefit from. And the fact that so many countries joined increased the momentum, so we are in a position to really do this in 2021.
On December the 30th, Britain became the first country to give emergency authorization to a coronavirus. Various countries have also started their vaccination program. How do you comment on the pace of inoculation versus safety? Because there are individual incidents of people suffering rather severe side effects, and yet the need to vaccinate people as soon as possible seem also to be very high.
With any vaccination program, it's very, very important to continue to study how the vaccine affects people, whether there are any serious adverse effects, and that applies to every vaccine. And we need, and it will happen because we've seen such great collaboration with the scientists, we need to continue to do the studies. In 5-10 years, we may have a very different view of which vaccines we're going to be using continuously, but what is going on now will tell us all how to best proceed. So the critical thing again is transparency of sharing of data. really using the science, as I said, in solidarity to deliver those solutions.
And the virus is mutating, is changing. Now, in December 2020, you say the organization has seen no evidence to suggest that a new variant of COVID-19 identified in the UK has increased the speed of transmission or whether it's more deadly. But the UK's Health Minister Matt Hancock said just in December as well that the virus is out of control. So who should we believe? Will the vaccines be still good enough?
So I should correct that. We have certainly seen the evidence provided by the United Kingdom to suggest that this variant does have an ability to transmit more effectively. So again, what the advice we're giving to really reinforce the physical distancing, really enforcing the hand hygiene, the mask wearing, ensuring that people avoid being in close contact, avoid being in crowds, avoid being in closed settings with poor ventilation. That advice we doubly emphasize. Now, there are a couple of other issues with this variant that are not yet clear. We don't seem to see that it's causing more severe disease, so it does not seem to be making people more sick. And we're doing studies, there are some studies going on to see if it has any effect on the vaccines. So far, the information we're receiving is the vaccines should be effective.
Absolutely. Well, coming from the Chinese perspective, I do want to know your evaluation or the WHO's evaluation of the efforts that the Chinese people have been taking to fight the virus. It seems that some other Asian countries which were doing rather well have been hit hard again by the virus, and yet China seems to be able to hold its ground. What do you think makes the difference? There are other countries who have also done a stellar job, such as New Zealand. What do you think are the ultimate key here?
The key to doing this is to stay alert all the time, remain vigilant, keep on testing, and also to have your community really committed, your people really committed to taking the measures that need to be taken. The countries that have been successful have really brought their communities with them. Every individual has understood that it's in their hands to stop that. Every time people take measures to prevent transmission of this virus, they are potentially saving a life. And for us, we have seen in communities where that's well understood, the outbreak, it has been possible to bring it down even long before the vaccine arrived.